A 4-year-old boy dies. His mother and newborn sibling die too. Uganda's Ebola outbreak is accelerating, and the Trump administration's aid freeze has left health workers without critical resources. The New York Times reports that this worsening crisis, detailed in an article by Abdi, Latif, Dahir, and Stephanie Nolen on March 6, 2025, is being exacerbated by the abrupt halt of U.S. foreign assistance. Declared on January 30th, the outbreak includes cases in Kampala, a densely populated city of 6 million. A 32-year-old nurse, one of the first known cases, sought treatment at multiple hospitals before being diagnosed, exposing countless others along the way. Since then, 4 deaths, 12 confirmed cases, and 2 suspected infections have been recorded. The Ebola strain responsible has no approved vaccines or treatments, and experts warn the situation could spiral out of control without urgent intervention. During a meeting obtained by the Times, U.S. officials noted that the termination of $1.6 million in USAID funds has significantly hindered Uganda's ability to contain the virus. Critical lab supplies, protective equipment, and funding for contact tracing have vanished. Health workers on the front lines are exposed, unprotected, and afraid. With no USAID money and CDC expertise, it was like Uganda was left to die, said Dr. Herbert Luswata, president of the Uganda Medical Association. Regional disease surveillance efforts have also been defunded, raising concerns about undetected cases crossing into neighboring countries. Elon Musk's Department of Government Efficiency claimed in February that Ebola funding had been restored immediately with no interruption. Yet 4 of 5 contracts were initially canceled, and 2 remain inactive. Trump's policies resemble past examples of political disengagement, such as Bolsonaro's inaction during COVID-19 and Orban's restrictions on public health funding. The repercussions of U.S. disengagement from global health will not be confined to Uganda. Disease does not respect borders. The United Nations has now launched an emergency appeal for $11.2 million to help Uganda combat this outbreak. But misinformation is spreading, with many Ugandans believing the crisis is fabricated. The question now is not whether Uganda can stop this outbreak. It's whether the world will allow another preventable crisis to unfold. If Ebola can be ignored today, what happens when the next pandemic emerges? And more importantly, will we learn? Please subscribe to the Intellectualist's new YouTube channel, where we present insightful videos analyzing the current events shaping the world. Turn on notifications to receive the latest updates from the channel.